Well, thank you for coming this morning. We know that it is Christmas and New Year's, and we're getting ready for the holiday season. I'm Senator Renee Unterman, and I'm joined by Representative Sharon Cooper and Senator Valencia Seay, who came to present a prop for us. And she asked me if it was okay, and I said, of course it's okay. I thought
It worked for mine.
Yes, and I'll let you speak and tell a little bit about your prop. As most of you know, we're here at this busy part of the holiday season to talk about a bill that we're going to pre-file today, and it deals with dental hygienists and access to care. And I think it's very appropriate that we have the two chairmen of the Health Committee at this busy time of the year, knowing that this issue is so important to us, and also knowing that the bill failed last year. And I think that's indicative, and it's really ironic, that during the interim of when this bill failed, that we've had historic changes in Washington, D.C. Mm-hmm. And when we left in March of this year, one of the main principles that Chairman Cooper and I stand for is access to care. And it was so ironic that access to care has been the interim dialogue from April until December, and I'm sure it's going to carry over for the next 2 years. The reason this bill is so important is because it's so simple, and it sounds so logical that you would not have to have a dentist in a brick and mortar building to be able to deliver care to people who desperately need care. The other thing that's interesting to me about the legislation is the fact, if you look at two longtime senators and representatives that have been here at the General Assembly for so many years, and you look at what we've accomplished and what our legacy is going to be. And one of the main things that Representative Cooper and I have worked on, and this lady standing right here, Senator Seay, is taking care of the elderly and taking care of our most vulnerable citizens. And it's never mattered to any of the three of us if those are the young or those are the elderly. Because usually in our society, those, unfortunately, are the forgotten people. And of course, children are, because they don't vote and they don't contribute money. And the elderly or the disabled, because they don't have the ability to be able to lobby on their own behalf. So if you ask me, my fiduciary responsibility being down here is to take care of the weakest of the weak. And that is literally what we are trying to accomplish with this bill. I'm going to let Representative Cooper tell a little bit more details about what occurred last year and why we feel like this is so important that we're willing to come down here and pre-file a bill, and the two chairmen of a committee take this as one of our #1 priorities for the next year's session. And the thing that's most remarkable to me when you talk about access to care and Georgia's standing in the whole United States, the fact that I believe I read in one of the articles that we're number 42 and 45 in the nation for health care parameters. And you look at states that are remiss in changing this law. And unfortunately, we are with 3 other states. Well, we're with 2 other states. We're one of 3 states, Alabama and Mississippi. And to think that as progressive as we are, here we are, we were over in Athens a couple weeks ago talking about being #1 in the nation for drawing health IT companies to our state, downtown Atlanta. It's just amazing that we could be up on the scales here with health IT, but one of 3 states in the nation for access to care about oral health care. And it's like a dichotomy that you just really can't comprehend. But then if you look at scope of practice and mid-levelers in the state of Georgia, you understand that we're one of the most restrictive states in the nation. So when you argue about issues like Medicaid expansion and all of these very controversial topics, it's just amazing to me that one simple law that could change access to care for literally millions of people to be able to have it, and our most vulnerable citizens, that it's a no-brainer that we would get this bill passed. So with that, we have the intricacies of the bill, and it's essentially the same thing that we had last year, where it's safety net settings, that they will have access to care, whether that's a nursing home, whether it's an FQHC, a federally qualified health care center, whether it's children in need. In Georgia, 159 counties, as we all know, we have 159 counties. 118 counties of those 159 are considered dental health professional shortage areas, meaning there are not enough licensed dentists in those areas to meet the dental care needs of the public, resulting in individuals seeking emergency care for dental issues. I have lots of friends that are emergency docs, and when I ask them, you know, what is the #1 reason that people show up in the emergency room, and they always tell me, Renee, believe it or not, and I know this from being an old emergency room nurse at Grady, the #1 reason is a toothache. And you think of yourselves, and you think of yourself having insurance and taking care of your mouth, and you wonder how you would show up in the emergency room with a toothache. Well, it's very easy if you don't have access to care. It's also if you've ever had a toothache and you know how much it hurts, or if you have gum disease, if you have periodontal disease, you know the problems of when you brush your teeth and you look in the bowl in your sink and you see blood, you know how terrifying that can be. So all we're saying is, why not have access to care? And that is oral care, and to have it evenly distributed, and that these vulnerable populations that we're talking about, that they also have access to care. And that's our goal in trying to write this legislation. And we've heard lots of excuses about why this shouldn't be done. I'll let Representative Cooper talk about those, and I don't want to take her spill. But I'll be glad to go over if you want to. I don't think we made copies of the bill, did we? Did we make copies? No, I don't have a copy of the bill, but we can go over the intricacies of the bill. Representative Cooper.
Thank you.
Thank you.
I like the charge. Well, thank you on my behalf for coming today. It is a busy time of year, and I appreciate the concern from citizens and groups all over our state. Let me give you a little background on what happened. Last year, we had another legislator put in a dental bill. It was wide open, and it came to my committee, and that bill was introduced in the House and the Senate. And it was wide open, and of course the dentists were in opposition to it. So like I do with so many issues in the Health Committee, I sit the groups down, or if they don't want to be together, I'll talk to them separately, and we came up with a compromise. I will tell you that compromise left the dentist in total control. A dentist could decide whether they wanted to let their dental hygienist go out and work independently in one of our safety net settings, or they could decide they didn't want their dentist to do it. Their dental hygienist to do it. If they had 4 dental hygienists, they could decide they wanted to let 2 do it because they trusted them to do it. It was a good compromise, and the representatives from the Dental Association stood up in committee and said that they were in favor of the bill and had agreed to it. Now, I've been chairman of the Health Committee in the House since Republicans took over in 2005, and I've brokered a lot of compromises, and I've never had one reneged on after it was said in the committee that an agreement had been reached. Now, this is going to be seen as being against the dentist because apparently anything you say that's not in agreement with them, they take it as an attack. I believe in telling the truth. I'm from Texas and I don't know how to do it except tell you like it is. And I'm not attacking them, I'm just telling you what happened. Here again, a bill where the dentist they were in total control. If there was any money from a Medicaid patient, the dentist got the money. The hygienist didn't. The whole purpose, right now the law stands, that there must be a dentist in the building for a hygienist to be able to work. And all we wanted to do was let a hygienist be able to work in our safety net settings without a dentist being present. Now, this was not to do x-rays. It was not to go in and do the deep scrapings. This was basically do a cleaning and fluoride treatments. The things that many of our children need to prevent dental and further dental decay. And I would tell you that they were saying that it was the camel's nose under the tent. Well, I think in 47 other states, they already let dental hygienists have expanded different degrees. And so that the dental hygienists wanted independent practice. And there was a bill put in a couple of years ago, and it was amazing. They took a sentence out of context and sent out part of the sentence, the Dental Association did, but they didn't send out the last part. So many dentists across the state actually thought that's what the dental hygienist wants. And it was misinformation. And I will tell you that many of the dentists across this state don't belong to the Dental Association. Now that's not unlike many associations. There are a lot of doctors that don't belong to MAG. But many of those dentists and those younger dentists see this as a valuable asset to their practice. And, you know, I think that if anybody knows me, I do have an advanced degree in nursing, and I do believe in mid-tier level, but I'm very careful about expanding a scope of practice because ultimately it's the patient that I'm concerned about. So I never promote an expansion of any kind of practices unless I'm sure that it's a patient safety factor. I think that, and I can ask everybody in this room to give me a show of hands. How many of you, when you go get your teeth cleaned, see the dentist first before the hygienist cleans your teeth? Can I see a hand? No one. One? John. John is my intern. And if it's true, John, fine, but okay. Okay, no one in this room of about 50 people have that happen. And what happens is the dental hygienist cleans your teeth, and the dentist comes in for a couple of minutes and looks over and says fine or so forth. And the dentist kept insisting that unless the dentist saw the patient first, that there would be terrible consequences. My reaction was, and I know it's a little different, look, we let nurse practitioners and PAs do things that will kill you. And you're saying that getting your teeth clean. So, I'm not attacking the dentist. This bill's a little more open than last year's bill was, but anybody who lobbies down here knows, or any group knows, that what we're looking, and you have compromise. And, I would be happy if last year's bill was what we ended up having. But this one's a little more open. They kept talking, the dentist did, about South Carolina. So we went to South Carolina and looked at the South Carolina law. Most of the dentists in the state are trying to do the best job they can. And we pay them very little to treat these children. And we have very few dentists across the state that are willing to take our Medicaid children and to go out into our free clinics and check people. If it was a perfect world, everyone would see a dentist first and have their regular dentist. Everyone would have access to a dentist, but they don't. And I believe strongly in preventive care. And if a child can't see a dentist first and have a regular dentist, I believe there is value in that child having his teeth cleaned and getting fluoride treatments, and having a well-trained person say, I need to send home a note with your parent, to your parents, and sending home a note to that parent saying, your child has multiple cavities, this is going to lead to this, you need to get that child to a dentist before they have severe dental problems. And one of the things the bill did, it said, it told who that hygienist was working for. So certainly, if the parent didn't have one and that dentist would take Medicaid patients, there's a direct, communication between the parents. I don't know how to make it any safer, but I'm willing to work with the Dental Association, not trying to bash them. I love my dentist. He doesn't hurt. And been with him for 30 years. So whatever we can do, I think if you listed the people that are in this room for the news, they're groups from all over our state. And like I said, I hope the right information can get out about the bill, because I think I ran into one of the other legislators at a antique place, and she had a friend with her, and she said, oh, this is so-and-so, her husband's an orthodontist. And I said, oh, and she said, well, we weren't involved in that last year, but I hear that the dental hygienist wanted independent practice. And I went, oh no, that wasn't it, but they believe it. So I hope that the word can get out, that no one is trying to let dental hygienists in this state or any time in the near future have independent practice. This is about working with their dentist to allow them to go out into the community and help our most vulnerable citizens. And then hopefully, if those children or citizens need the services of a dentist, to help guide them to that dentist. And like I said, dentist totally in charge. Any money passes, the dentist gets it. And like I say, I think a lot of the younger dentists are in favor of the bill. Like in all professions, sometimes it takes the older people that seem to run the organizations and have gotten up to that point and have the time to be involved in their associations, a little time to see that the times are changing, but it's not always bad. Thank you.
Seriously?
And thank you, Senator Nancy, and thank you all. A picture is worth 1,000 words. And my colleagues have already laid it out, and I'm totally in agreement. But I'll just share, for me, I was at a national conference, the National Black Caucus of State Legislators, and when a hygienist was presenting, I was walking in the conference, but they were showing a map, and at the time that map had 4 states, and Georgia was one of them, which got my attention. And afterwards, I went to the hygienist that was presenting, and I said, I represent Georgia, tell me more. And they had a dental therapist bill that they sent to me, and that's the one that I dropped, because I wanted to start the conversation. When I spoke to my personal dentist, what I said to my personal dentist is, I am so glad I get to talk to you just for a brief moment, because I spend more time with my hygienist. But when I heard the comments about scope of practice and all of that, I asked my dentist, when you hired your hygienist, weren't you looking for the very best that you had? So when you got the very best, and you know it's the very best, and you trust them with your patient load, why not all over Georgia? Georgia is better than being one of 3. Georgia is better when we have the world's busiest airport, and we have folk in our state don't have access to care, and there's an easy fix. For me, it's not just underserved, but unserved. So I said to the Dental Association, you're not there, so nobody's taking away from you anything. What we are doing is giving access to very necessary care. It's simple. It's arithmetic. Come on, guys. We really have to do better, because we are Georgians and we are the best in the South. And I'm hoping I could be one of the co-signers and we can move this thing out of here and give all of Georgians access to care. Thank you, Madam Chair.
Well, and I think this brings up a point. We are, I think now, the 8th fastest growing state in the United States. We vacillate between 6 and 8. We're growing 4 to 1 with an elderly population. Our dental school is full. I was down there at the Medical College of Georgia. There is only one dental school in the state of Georgia. They have all the students that they can take. They have no capacity to take any more. And of course, as you know, just like we have in med school, where you go to dental school does not mean you will stay in that state. And especially, we are a rural state. People in the metro area sometimes forget that. But we are very rural, and just like with physicians, we have trouble getting dentists to go to our rural areas. And so that means a total lack of saving. And like we said, I mean, I will be glad to work with the dentist and try to put, realistic safeguards, not ones that block what we're trying to achieve, but realistic safeguards I tried to do that in last year's bill, which they agreed to, but I'm willing to work with them again. This is a bill and its time has come. Okay.
With that. I just want to say thank you to all the groups that came today. I know we have the Georgia Council on Aging. I know we have some children's groups here, several different groups that have a vested interest, and advocacy groups that represent a lot of those most vulnerable citizens that we were talking about. I just want to say thank you for your support last year, and we look forward to working with you again this year. I'll run through the bill because I know we haven't gone item by item. If you want to go through the bill, it says statistics show that nearly 1/3 of older adults have untreated tooth decay, and nearly 25% of adults 65 to 74 have severe gum disease. I already talked about the 159 counties in disparity. 118 counties are professed to be dental health care shortage areas. And we did take some of the same exact things. We're starting off from the point that we left off in March and picking back up some of the exact same things that we addressed in this year's bill still. We improved the language a little bit and talked about licensure, licensed dental hygienist and licensed dentist. That was just an anomaly that was in the code section. We further defined those community-based settings, saying volunteer community health settings, senior centers, that would be a very appropriate place, battered women's shelters as defined by the board. We then reiterated what constitutes where a dental hygienist can be served. A patient must be examined by the authorizing licensed dentist at a minimum of 12-month intervals. So before you're let loose out of the cage, so to say, you have to be seen by a dentist first before you could be seen by a dental hygienist in the safety net setting. That was very important. The new language in school settings, licensed dental hygienists may apply topical fluoride, as the chairman talked about. In hospitals, nursing homes, long-term care facilities, rural and community clinics, health facilities operated by federal, state, county, or local government hospices, and in bona fide charitable institutions, licensed dental hygienists may apply topical fluoride and perform the application of sealants and oral prophylactics under general supervision. General supervision is the key word because that means you still have that tie, just like a physician assistant has a tie to the doctor. You still have that relationship with the dentist. Treatment may not occur in these settings unless emergency care is available within the facility. That's very important to be able to have that. That was one of the issues that the dentist brought up last year. A licensed dentist may only authorize up to 4 licensed dental hygienists to provide dental hygiene services. It was really interesting. I was at a football game a couple of weeks ago. Of course, it was Buford football game. And the dentist was there, and they were talking about going on vacation. And the dentist said, you know, I can't go and leave my practice open. I have to literally close my practice and go to Walt Disney World with my kids. I can't leave the practice open to accept appointments, blah, 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 and to do business as usual. She said, I love the ability to be able to leave my dental hygienist, and I have enough confidence in them that they can perform their activities, knowing that they're doing a good job. So general supervision means that a licensed dentist has authorized the delegable duties of a licensed dental hygienist, but does not require that a licensed dentist be present. A licensed dentist be present when such duties are performed. So that's the brick and mortar part of the legislation, that the dentist does not have to be in the building. Like I said, it's common sense legislation. It's my pleasure to be able to work on it this year. I hope and pray that we do not have the bumps in the road, because I can't imagine that you're going to win the media reception when dentists say we don't want to take care of everyone, and especially the most vulnerable populations. When I think of people going into a nursing home or going into hospice care, you shouldn't be denied the ability to get your teeth cleaned. a dental hygienist could go into that setting and take care of these folks. You would no longer literally have to put them into a non-emergency ambulance and take them to a facility. They could stay in place. With the aging baby boomers, this is critical. They could stay in place and at least get their teeth cleaned. They can already get their hair fixed. They have beauty products there. But now literally they can get their teeth cleaned. That's a basic necessity to me, a basic necessity in life, so that you don't have discomfort. Even if you've only got 6 months left to live and you're in hospice, it's a basic necessity to have and maintain that quality of life, to be able to die peacefully and not to have something drastically wrong. So with that, we'll answer any questions from the media if they have questions.
Could you explain how this is, you said, Chairman, you said that this is a little bit different than what you ended up with last year?
It's a little bit more open. Last year's bill really didn't have the general part out in the public.
What does that mean? I'm sorry,
Okay.
in non-medical
And
English.
we did it only with the safety net settings.
Right.
This would allow my dentist, if they were sick, to allow they wouldn't have to close the office.
Gotcha.
Because technically, I mean, and legally now, they must close their office. They want to go on vacation, but this bill would allow them, or to let their hygienist, if they were scheduled with 7 cleanings that day, the hygienist
They
would be able
wouldn't
to go ahead
physically
and
be
do
there, in
those.
other words.
That's right.
That's right.
That's the brick and mortar part. You don't have to be in the building.
And already, the public health hygienists have the right to do this. They've had the right for several years. I don't even know when that
25
passed.
plus.
25
And
years.
Department of
25 years.
Corrections.
And, you know, we can find no record of anyone being injured or dying from having the dental hygienist be able to do this without a dental present. Part of their license requirement is CPR and emergency training every couple of years, continuing education. They really are, they do have a.
They're healthcare professionals.
Their healthcare professionals have a really
Exactly.
rigorous relicensing as far as handling emergency situations and all.
Good question, though.
I want to make sure I'm understanding the financial transaction, so all the money goes through the dentist still, and the hygienist receives their regular pay, I guess.
It would be just like a nurse practitioner or PA working for a physician in a physician's office. And it would be just the same way. I mean, we can tell, as a legislature, we can tell physicians that PAs and nurse practitioners can do this. But a physician has the right, if they don't want their PA to order antibiotics, I mean, they can tell them, this is not in your protocol. I don't want you to do that. It would be the same way with the dentist. They would, the dental hygienist is a mid-level provider, and they would be working under the dentist. Go ahead.
Yes.
I'm not pressed, but I did want to say that I am a dentist, and I'm in full support of this bill, and part of a Robert Wood Johnson Clinical Scholars Programs with my colleagues, Dr. Moore, who is, I'm Chief of Dental Medicine at Grady. Dr. Moore is Chief of ENT at Grady, and runs the healing community centers, and we have Dr. Hope Asinius, who's an advanced nurse practitioner. Our project is, actually our WICKET project is to increase access to care in Georgia, and we're very supportive of the fact that this bill is coming to fruition so we can increase access to those that are low-resourced or most vulnerable in our state. So thank you so much.
And I think you're my constituent.
I am.
Most important thing.
And I appreciate all the work you've done with HIV and all the other areas that y'all have worked on.
Thank you so
for
much.
that. And, you know, I will say that, you know, we're open to talking to the dentist, and you learn something, you know, all the time. And one of the fears that the dentist had was that hygienists would go out and get a mobile unit and they'd just go clean all the teeth. And so, yeah, they're gonna be busy, because I think they estimate there's 500,000 children going without, that are on Peach Care, that are entitled to having this service but don't get it. And, but one of the things that they said, you know, last year we put up, said a mobile unit couldn't come, you couldn't travel, and you had to have an office within 40 miles or something like that. And I think that, you know, we can certainly do that. We can say that the mobile units have to have the dentist with them. or we can do some safeguards like that, you know, if the dentist talk to us and just don't always say no. And, you know, so we're out to allay fears, but also not to restrict it where we don't reach our goal of having more children and vulnerable adults taken care of.
I'm Susan Krimmering, and I'm here as an individual interested citizen, but I've been twice past president of the Georgia Rural Health Association. I was very interested in Senator Unterman's quote on the overlap of the area of rural Georgia without adequate dentists and the conversation she had with emergency room physician and
Right.
oral care. As we all know, and as your study committees have continued to hear, the plight of rural hospitals and the care that is being delivered for oral health emergencies that's costly and oftentimes unreimbursed. And has anyone looked at the financial potential savings for the state of Georgia for rural hospitals that are caring for these people and have no other options because they're mandated by federal law to see everyone?
No, we haven't looked at those statistics, but what we have looked at is Southwest Georgia, which has the highest, as you probably know, since you work in the rural health care, has not only the highest cost, but the highest disparity. If you look at Metro Atlanta and you look at Southwest Georgia, I will never forget going on a trip down to below Albany, right on the Alabama, Florida, Georgia line, and going to a public health center. And it's a cinder block building. And I asked the public health nurse, who are the other professionals in this county? And she said, ma'am, we have no supermarket, we have no place to buy gas, we have no health care in this county, we have to go out of this county and into the next county to be able to receive services. I am the only professional other than that building right there. And she pointed at the building next door, and that's where the sheriff was. And I said, you know, that's really remarkable. What do you do? They don't have cell phone service. It is truly, to me, it harkens back. I've traveled all over the world, a third world country. And it's not fair for us as legislators to be up here in the city of Atlanta, in major metropolitan. I represent a county of almost 1 million people. Representative Cooper does. All three of us represent almost 1 million people in our counties. And it's our responsibility not to just look after those 1 million people in those counties, but to think about that little public health department and those people that are there. Those are the people that are literally left behind because their children have migrated to the metro Atlanta area. And who is left in those rural areas is the most vulnerable. It's the oldest, it's the sickest, it's the unemployed, it's the people who have no mobility. So to me, I'm looking after the 10 million Georgians, not the people just in Gwinnett County that have a plethora of dental services on every corner. I have billboards all over my district advertising dental services. But I'm thinking about that public health department in Southwest Georgia and how we can improve access to care and how we can be not one of 3 states in the nation that doesn't offer the very best of dental care for our citizens.
And Madam Chair, if I could just add, on January 9th, when we get sworn in, it's for Georgia.
That's
It's
right.
not just from our district.
No.
And that's what I had to tell one of my dentists. I mean, Georgia's better than that. We
You mean-
are all representing
You
Georgia.
had to do that in the Senate? I had to do it in the House.
Well, that's why we're a 10.
I mean, you know, and sometimes it's hard to stand up to your own profession. I mean, I've had the nurses scream at me, why don't I help the nurses and all, and, you know, I do when I can, but we're sit down here to represent everybody in our district, and as chairman of the health committee, we also are sent down to do what's best for all Georgians. And for me, it's what's best for the patient that it guides whatever I do. And so, but sometimes it's hard. I mean, it's really hard to have had the nurses scream at me, why don't you help nurses? Because first and foremost, I am a nurse. And like I say, I have an advanced degree in nursing. So when they go after me, but I'm trying to look at the whole patient and the you know, the picture, the patient's point of view. And we jokingly, we like our colleagues, but you know, sometimes you just have to explain things to people.
Is there any other questions? Well, I know there's plenty of advocates here. If you're with the press, there's plenty of advocates that you can address. And we thank you for
Very
coming out
much.
of your busy schedule, and Merry Christmas and Happy New Year.
See ya in January.
I'm in here, open that door.
Thank you.